Nowadays, couple who are approaching us for fertility very well educated, well read, and well aware about the process. They come up with a lot of questions to us, and here in this video, I'm going to answer a few of those questions. There is no different types of IVF. We have different protocols for IVF. Maybe I can put it in that way. So there are different protocols. Olden days, that is like 20 years before, we were using something called a long protocol. In this long protocol, we used to start the medications 10 days or 12 days prior to their menses itself, and then we continue to do it for a longer time. So this is called long protocol. And nowadays, recent days, that technologically we've developed and evolved so much that we're not using that protocol, and what we use now is very short protocol. That is, from the second day of your menses we start the medication, and it goes only for 10 to 12 days, and then we reach the egg retrieval stage. So these are the differences. I don't think there is any long term and short term IVF. So fresh embryo transfers happening in previous days, that is olden days, probably 20 years before, where we were not very confident about the freezing protocols. So fresh embryo transfers was definitely being done before. Nowadays, we are able to vitrify the embryos, that is freeze the embryos, and vitrification techniques have tremendously improved and gives a very good result. Hence, I feel nowadays frozen embryo transfers give us a better result compared to fresh embryo transfer. There are certain patients who will definitely need a fresh embryo transfer. So it is more individualistic, that is each patient we have to individualize rather than blindly saying that this is better than that. But nowadays mostly we are using frozen embryo transfers. So pre-genetic test is, I think it is pre-implantation genetic testing. This is done to the embryo. So this is not routinely done, not for all patients who are undergoing IVF. This particular test is being done because this is very expensive and also it is invasive. So we biopsy the embryos, that is we take out a small cell sample from the embryo and then send it for testing, and this might also cause damage to the embryo. So where do we do this? When there is a history of genetic disease in the family, when the couple have repeated multiple abortions in the previously, or repeated multiple IVF failures, and if the husband or the woman is carrying any particular kind of genetic disease in them, that is chromosomal change in them, and these are couple where we do or recommend a pre-implantation genetic testing, but not for everyone. So depends on the protocol we start. So the recent protocol, that is ANTAC protocol, which we are routinely using for many couple, we start from the second day of her periods, and there is a particular injection which is given for the initial 10 days. Usually most of the women will respond in 10 days of medication. There are very few women who will not respond and might need a longer duration. So in general, I think the medication is given for 10 days, and then a trigger injection is given on the 10th day, and 12th day we go in for a egg retrieval. After removing the eggs, the sperm and the egg is united, that is fertilized. We call it as insemination, and that is done on the 12th day, and we allow the embryos to grow for 5 days, and then we go ahead with the transfer. Typically it might take around 17 days for the entire process to get over. So any couple who are conceiving normally, what risk factors they have for their child is the similar risk factor as what a couple conceiving with IVF also will have. There is no specific or particular genetic changes or mutations or any difference which is happening particularly for the IVF babies. I think the first IVF baby was born in 1977, that is Louis Brown, and I think it's been so many years, 46 years of IVF. I don't think there is any particular damage or defects which are happening with the children. In the recent 2021 ART Act which has been released in India. According to that act, single women and single men cannot do an IVF, and what they recommend is ever married women. They should have been a divorcee, they should have been a widow to get the IVF done, but not never married women. So this is a very nice question and very important because many people have this question in their mind. There was a very big study which was done in 2019 and released in 2019, in which they've analyzed around 10,000 patients who conceived through IVF in a period of 3 years. And in that, I think they found around 11.8% of women had a risk of miscarriage or have been through a miscarriage. So it is almost equivalent to a natural couple risk. Any natural couple has what kind of risk factor they have for a miscarriage. It is exactly similar to that. I don't think IVF couple per se will have a increased chances for miscarriage. IVF pregnancies are little high risk pregnancies. I think when the woman is conceiving at their 35 or more than 35 years of age, there is a bit of risk of preterm delivery that we do see, but exact percentage I'm not able to tell, but then there is a bit of risk of preterm delivery. And also large for gestation babies, when we are doing a lot of frozen embryo transfers, there is a bit of increase in pregnancy-induced hypertension and also large for gestation babies, that is big babies. These are small obstetric risks which are seen. Yes, definitely a woman who's conceiving through IVF doesn't mean that they have to always go through a C-section. If they are physically fit, they are doing all their physical exercises, they're preparing themselves for the labor process, they can be allowed for a normal delivery. It is not mandatory that they have to go through a C-section. So it depends on what kind of problem you have. Why is there a delay in conception for the second child? If there is a definite indication for IVF, then you should get through an IVF done, but not always. So it depends on what kind of problem you have. These are few questions which I received recently. I encourage all my patients to send their queries, and it is better to clarify them through a doctor.